Shoulder injuries in sports can be treated in a lot of different ways. When we ultimately get to surgical interventions, shoulder arthroscopy becomes very important, and we can treat a lot of shoulder injuries that are sports related through an arthroscopic approach. Injuries such as rotator cuff tears, labral tears, a child playing football maybe has a shoulder dislocation, tears their labrum. They could be a good candidate for an arthroscopic surgery, which is minimally invasive. So the thought process is you have a quicker recovery. We still have good outcomes with those kind of treatments, and that's something we offer here. Rotator cuff surgery, injuries, tears, we are really common arthroscopic treatments as well, and we see that in a lot of, I want to say older athletes, but a little bit older athlete and active middle age in older individuals, and we can treat those with surgery as well. When should you kind of come? If you're having shoulder pain and come to the office, you might have some physical therapy, those kinds of things. If things continue to bother you, we may end up getting advanced imaging such as an MRI scan. And if you have an injury or a tear, you might be a candidate for these kinds of treatments. So if you have a rotator cuff surgery, you're generally going to be in a sling, immobilized for 4 to 6 weeks, where you're kind of just able to use your hand. And then after that, the sling will come off and you'll be doing more light activity for the next few months. We avoid heavy lifting, pushing and pulling for 4 to 6 months generally. During that time frame, that first 3 months, you're doing physical therapy as well. If we get an athlete that comes in that has recurrent dislocations or what we consider shoulder instability that's recurrent, we'll often work that up as well, and they can be a candidate for an arthroscopic procedure where we can go inside the shoulder, visualize the labral tissue that gets torn, repair that with anchors. It's an outpatient procedure. They go home that day, and then usually in a sling for a month, doing physical therapy, taking it easy, and we can anticipate return to play in 3 to 4 months for most kids. Well, for painful shoulders that you think might go away, but it continues to bother you, it's advantageous to come to the clinic and have x-rays and at least get evaluated by us so we can see, because there are some common problems. An x-ray tells us a lot. You may have an arthritic shoulder, which could be treated with therapy and sometimes a steroid injection, or ultimately potentially a joint replacement if necessary in the right patient. But getting evaluated, potentially getting an MRI, you may have a torn soft tissue such as a rotator cuff or a biceps tendon or labrum that's causing your problem that we might, could fix or treat, with surgery, potentially arthroscopically.